Hi, everyone. As a mom in this difficult season that you're in, you are without a doubt dealing with the grief process. There's really no way around that. And so I want to talk about the physical symptoms of grief today. And I'm quite sure that you will be able to raise your hand to more than a few of them, I would imagine. So for those of you that are brand new to my channel, I just want to welcome you. My name is Sally Harris, and I am a mom who walked a difficult road with my own daughter for over 10 years. And while her life spiraled out of control, so did mine. And it does not have to be that way. And today I want to talk about grief because everything that you're going through in this difficult season falls into one of these categories of grief. And what ends up happening is it affects us physically. So I want to talk about these physical symptoms. Now, just want to preface this with, the stages of grief. You've all heard them at one point or another, and maybe it's very fresh in your mind, but maybe you're like me, and I didn't used to think that grief could be something that we could experience. That was only for loss of a loved one to death. That's what I used to think years and years ago. And obviously I was wrong, right? So the stages are denial, anger, depression, bargaining, and then acceptance. And I don't want you to beat yourself up if you are navigating that, what I just shared with you, those 5 stages, because they're not always going to go in order, and they're not going to just last for a certain amount of time and then jump onto the next one. And then once you hit acceptance, you're good to go. Like, it doesn't work that way. And if it did work that way for you, that's fantastic. But that is not the way it worked for me or any of the moms that I coach. So we're going to go back and forth, and that's okay. However, what I want you to be mindful of are these physical symptoms that start happening. Now, some of them are very normal. A lot of them are normal, but it doesn't mean you want them to stay, right? Which is why we need to do the work to get out of this grief cycle and be able to move through this, a little bit quicker for your own health. And so some of these things, definitely going to ring a bell for you. The first one is talking about appetite, right? Some of you may have lost your appetite and you're losing weight. Some of you are overeating and had gained weight. So I had gained 70 pounds during this season. And another piece of that for me, which is another one of these things on my list, is we increase the use of alcohol or drugs to cope with grief. And that is what I did. So the combination between excess alcohol and excess food meant a lot of weight gain. And this isn't just about a number, this is about your health. And that's why I'm talking about this today. It's more than just how you look. This is what's going on the inside, right? Here and in your body. So another one too that a lot of moms deal with, and I did as well, is difficulty sleeping. So you may find yourself in that depression state where you are doing the opposite. Like, you aren't having trouble sleeping. You can't get out of bed. You're not wanting to get out of bed and face the day. And so you are sleeping too much. And that is definitely something that I hear a lot. Another thing is, as far as literal physical symptoms that probably are a little bit more, you might be more self-aware of. These other things it may take a while to realize that's what's happening because they're more habitual, like actual habits that you're doing. You're actually eating, you're actually drinking. But when you start getting headaches or stomach aches, physical pain that you start feeling, especially when you're reminded of the situation or you start talking about the situation or you get triggered by something and all of a sudden you start getting these headaches and stomach aches. That right there is definitely in the grief cycle. And these are things that are happening because of your situation that you're going through and how we're handling it, right? And so we need to obviously do things to make these things stop and go away. Another thing too is increased heart rate. I know a lot of you, because you've told me, you have also dealt with what I did as far as increased heart rate and literally thinking that you were having a heart attack sometimes. I mean, I called the ambulance on myself. I was home alone and called the ambulance on myself because I thought I was having a heart attack. And it was stress. It was stress. And many of you tell me the same things. So you also may notice that you're having a hard time making decisions, right? Or sticking with something or concentrating, whether it be at work or at home or even when you try to do things you enjoy, you're having a hard time concentrating. You may feel moody. You have these emotional highs and lows, which is affecting your relationships, right? Many times we feel so numb and almost disconnected. We seem to think that we're the only person in the world going through this. And you and I both know that's not true. But when you're in it and this is new to you and you are trying to manage this, it feels like you're the only one. Like, how in the world did this happen to my family? This is not, what we had planned. This is not how we thought things would go. This is not what my son or daughter acted like when they were younger. Yeah, I hear that a lot too. And I can relate to that. So just the persistent sadness, anxiety, guilt, depression. We have self-guilt, we have self-blame, we blame other people, we make other people feel guilty, we have resentment, we have all these emotions that are going on, and these all just take you through this grief cycle. You'll try to bargain, you'll be depressed, and when you finally get to a day where you feel like you can accept what's happening, I almost feel like sometimes we have to get, even just to have acceptance within our sight, to be able to say, I have got to change my life. I've got to do something different, because that's, for example, what happened with me. And just to share my story just briefly about the physical symptoms, but just to let you know, for those of you that I've never chatted with before, I have what's called a discovery call, and it's a 30-minute consultation where if you are ready to do the work and you really want help, I want you to reach out to me. And we set up a time. You can choose a time on the calendar. It's a 30-minute consultation where I learn more about what's going on, but I want to hear about you and what's happening to you through all of this, because that's where I can help you. And so I look forward to talking with you soon. But as far as my personal story, to be honest, a lot of that, I was going through all these emotions, just about everything I've named here I have experienced. And it came to the point where it started physically affecting me, to the point where I had some scans done, and doctor told me that I was very likely going to have cancer within a year if I didn't change some of my habits. And this is someone who didn't know me, because I had just moved, and didn't know my habits, didn't know I was drinking in excess. Obviously, I was 70 pounds overweight, but they didn't know why or how long I had been that way. I was new to them. But I took it seriously. And my hope for you is that you don't wait until you get a diagnosis. Don't wait until somebody labels you with something. And you can fight through this, because you're stronger than you give yourself credit for. And that I do know, because I just buried myself in shame and guilt and hurt and pretty much wine, to be honest. I just used alcohol to numb it because I didn't want to think about it. I didn't want to deal with it. And my hope for you is that you don't do that, because it's not going to help. And actually, one thing I can promise you with that is it's just going to cause a whole nother mess of problems in your life that you didn't have before. And so let's face this thing head on, and I can help you. And so if that's you and you're ready, I look forward to talking to you in the discovery call soon. But until then, I just want you to do something for yourself today. Take care of yourself. Look in the mirror. Tell yourself that you are worth it. And if you don't have enough hope for your situation, I promise you I do. I do. On the outside looking in both my heart and people around me, it didn't look real promising for my daughter either. But she's restored and healthy and whole. And your son or daughter can be too. And most importantly, so can you. And so it starts with you. And so when you're ready, I look forward to hearing from you. Take care.